I'm Dr. Rakesh Ojha. I am the head of the Department of Hematology and Stem Cell Transplant at International Oncology. We treat a variety of hematologic diseases. These include benign hematologic diseases, malignant hematologic diseases like leukemia, and we offer highly specialized stem cell transplant services to our patients. Some of the common diseases that we treat include anemia, thrombocytopenia of various etiologies. We treat malignant conditions like acute leukemia, multiple myeloma, lymphoma, Hodgkin's disease, and we treat benign diseases like aplastic anemia, which are highly lethal. For a variety of diseases, we use chemotherapy to treat these diseases, but sometimes cure is not possible by use of chemotherapy alone. In such cases, patients are identified and selected for undergoing stem cell transplantation. Stem cell transplantation requires that an HLA matched sibling is available within the family. The donor has to be a sibling which must HLA match with the patient before transplantation can be done. In most circumstances, parents, first cousins, or anyone outside of the family cannot serve as a donor. So once a patient is identified and a donor is identified, transplantation can be a possibility to get rid of the disease. Before transplantation can happen, patients and the donor, they undergo a variety of testing to make sure that they are eligible for transplant, that the patient is reasonably fit to undergo high doses of chemotherapy required. We make sure that both the patient and the donor, they do not have any infectious diseases like hepatitis or HIV, because it can become a problem in severe immunocompromised state that happens post-transplant. So once a patient is identified, a donor is identified, and they undergo somewhat rigorous selection criteria, they are admitted to the hospital for close to a month. For about a week or so, they require high doses of chemotherapy to get rid of the leukemic process. This is referred to as ablative treatment. The dose that is given is fairly high, and that practically wipes out the bone marrow of the patient. In order to rescue the patient's bone marrow, we give them stem cells to the patient so that the bone marrow can recover. Now, the transplantation can be of autologous variety also, where we collect stem cells from the patient before they are admitted for transplantation. That is referred to as autologous stem cell transplant. Allogenic stem cell transplant is basically transplant which is done when the donor is usually a sibling. In both cases, once a transplant is performed, it is required that the patient stays in the hospital for close to 3 to 4 weeks, because stem cells take close to 2 weeks to grow back. It takes about a week further for the blood elements to be formed by the bone marrow, and a week beyond that it is required to get free from transfusion requirements, free from infections before the patient is eventually discharged. Post-transplant follow-up has to be very close, at least for first 3 months, because this is a very high-risk period, and patients are at risk of getting infections and certain complications like immunologic complications like graft versus host disease in allogenic transplants. So even after a patient is successfully discharged from the hospital, close to 3 months post-transplant is a fairly high-risk period requiring very close follow-up in the OPD, which is almost on a weekly basis. Beyond that, after first 100 days, the follow-up gets less intense. It can be usually every 2 weeks or so for up to 6 months before patient achieves stability, and then we reduce the follow-up to up to a monthly basis. Now, the follow-up required in allogenic transplantation is much more intense, but in autologous transplant, after 3 to 4 months or so, the degree of follow-up, the requirement of follow-up is much less intense than in allogenic transplants.